Great. Welcome everyone to the third webinar in our series on the Medical Research Future Fund. I'm Agustina Gancia. I'm a Senior Project Officer at Health Translation SA, and I look after the consumer engagement and the capacity building tasks at Health Translation SA. We're looking at the Medical Research Future Fund this week. Specifically the perspectives from the reviewers who have actually reviewed grant applications for this fund. Before we begin our webinar, I'd like to acknowledge that the Ghana people are the traditional custodians of the Adelaide region. We recognize the Ghana people's cultural, spiritual, physical, and emotional connection with their land. We honor and pay our respects to Ghana elders, both past and present, and all generations of Ghana people now and into the future. Before we delve into our conversation with our panelists, I'd like to just quickly introduce what the Spotlight series is and who Health Translation SA is as an organization. For those who have not joined our previous webinars, the Spotlight series is essentially our way of shedding the spotlight on a specific topic around research translation. This month, we're looking at the Medical Research Future Fund. We have 4 webinars talking to various specialists or people with expertise on this topic. We also share resources across our social media, Twitter and LinkedIn, so different links to the Department of Health, specifically the MRFF website, organizations that administer funds for the MRFF, top tips to succeed in your grant applications, and other resources as well. Does anyone have a question? I heard something. Today's webinar specifically is going to be from the eyes of the reviewers, and we have reviewers from 4 different organizations. We have Professor Susan Hillier from UniSA, we have Penelope Mcmillan, who's our consumer representative, we have Olivia White from the MDPP, and Associate Professor Niranjan Bidargaddi from Flinders University. From Flinders University. And as Health Translation SA, I'll just quickly introduce our organization. We are a catalyst for connecting people and our stakeholders and our partner organizations. And so our purpose is really to accelerate the translation of research findings into policy and practice. And so our aim is really to support researchers to translate their research findings and to connect with the end users and the next users of their research, whether it be people in health services, in policy, or clinicians. So let's just begin our conversation. I'd like to introduce our 4 panelists. Professor Susan Hillier is an academic and a clinician with teaching and research interests in the broad field of neuroscience and rehabilitation. Her current role at the University of South Australia is Dean of Research for UniSA in Allied Health and Human Performance. Penelope Mcmillan is a consumer advocate across aging, carers, disability, chronic illness, and ME/CFS. As a consumer, she's been involved in research, including as a project co-lead, and has reviewed MRFF grant applications, both as a generalist consumer rep and as a consumer with expert knowledge on a grant topic. Olivia White is the research translation lead for the Medical Device Research Institute at Flinders University, and she's a key driver of strategy for MDPP, ensuring continuous improvements of the program's major initiatives. And Associate Professor Niranjan Bidargaddi is the Associate Professor of Digital Health at the College of Medicine and Public Health at Flinders University. He leads the Digital Health Lab based at Flinders Digital Health Research Center at Tonsley and at SAMRI, and he's experienced in development, trial, and translation of digital health programs. So what I've done today is I've prepared 4 different questions for each of these panelists. And they'll each, in their turn, in 5 minutes, answer their questions. And afterwards, there'll be a Q&A session with the audience. So you can ask your questions to these 4 panelists. I'd like to start with Professor Susan Hillier. I would like you to tell us, so as an MRFF grant reviewer, what's the biggest mistake you've seen in grant applications for this particular scheme?
Thanks, Agustina. Great to be here. Sorry, I'm sitting in a stairwell, actually, in Melbourne, so if it's a bit echoey, the acoustics aren't great. So I've sat on probably maybe 10 panels now, quite a lot, and along a lot of different schemes. And I think that's the key thing that applicants perhaps don't consider, is that the MRFF is not one thing. There are so many schemes, and even within one, say, one mission or one call, there are lots of streams, and the panel have to consider them all separately. So the panels really stick to the parameters of the particular stream within the scheme, and people, the biggest mistake is that people don't address the specifics of the stream. So there might be an incubator stream 1 and a stream 2, and they'll just get tipped out straight away because they won't have addressed the actual key things, like, that it's the wrong population, or they haven't addressed the consumer aspect, or whatever else the specifics are, that it hasn't got that specificity. So it seems like a really obvious thing to say, but I think people would be really surprised at how many do get tipped out quite early, because the reviewer, the primary and secondary spokespeople say, well, actually, this doesn't actually meet the criteria. So my recommendation, therefore, is that you print out the criteria for the particular stream and the scheme, and you write your answers and you use that language, so that it's really easy for the primary and secondary spokespeople to say, yes, this does meet these criteria, because then all the assessing criteria are related to those things. It sounds like such a rookie mistake, but it's all we've got to go on. And I think my point is that these panels now are so specific, because the schemes are so specific, that we stick to the criteria a lot more than panels used to do, say, in the old NHMRC schemes, where the criteria are quite broad. So you'll see, primary spokespeople using the language of the criteria and the marking schedules. The chair reminds us to do that, and it's very robust in that way, I guess. So my point is also that don't go for a grant where you don't meet the criteria. So I think there's also a bit of a recycling of grants. Well, I'll just try it in this scheme or that scheme. It very rarely works. People can smell a recycle a mile off, because it doesn't meet the criteria completely, or it's been kind of tried to be remoulded. You really do have to start again, because this sort of rehash stuff, it shows up because of the specificity of the criteria for the individual streams and schemes. So that would be my 5 minutes worth of the major mistake about why people get tipped out early. And of course, just to remind people that, we're there to advocate for the grants that we like as spokespeople in a way, but we're also there to tip out the ones. So if you're not spot on, then the spokesperson will use any deviation from the criteria to say, I don't think this one, I think this is a 4 or a 3, based so we scale them from 1 to 7, but how closely they meet the sort of the 7 levels. And the panels have a fair bit to get through, and so they're looking for something to tip you out, unless they really like the grant. And this is the number one easiest way to do it. It's the kiss of death.
I like that.
Is that yeah. Look, and it sounds harsh.
It's scary.
It is scary, but I also want to say that, and I've sat on a lot of NHMRC panels and in other grant schemes internationally, and I just want to reassure people that these MRFF panels are really well run. Like, I really actually enjoy them now, because they get international experts. The expertise and the consumer reps and so forth are really, there's a lot of equality on these panels, and I want to reassure people that the grants get a good going over. So when I say, you know, kiss of death, I don't mean to be alarmist, because the panels are very fair. I have not sat on one where I haven't walked away going, that is a really good process, particularly because of the international content experts and the consumer rep, you know, and Penelope will talk more about this, but they have a very strong voice, and the criteria are very fairly assessed. So I do want to reassure people that it's actually a very robust process. I think it's the best that I've sat on.
Great. Thank you so much for that answer. I think that was really clear. Yeah, and really, really valuable to learn about that. So really don't go for a grant that you don't meet the criteria, and really, really look at the detail and to match the specific criteria that they're asking for.
Yeah.
I'd like to now go over to Penelope, who's our consumer rep on this panel. Penelope, the question for you is, as a consumer reviewer for MRFF, what are some elements that you look out for in an application? And I know you've prepared a slide, so I'll just go over here. So over to you, Penelope.
Well, before I start, I couldn't endorse Susan's points more strongly. If you don't fit the criteria, it doesn't matter how much I love your application, you're just not in the ballpark. And the other thing is the expertise. I've been in the MRFF, the little I've had to do with the panels, the level of expertise of the reviewers is really high. You're not going to get away with fudging figures or pretending you can do something, or I'll fix it after we get the grant, because those experts know what they're talking about, and they know what they're looking at, and they'll read between the lines and they'll sort you out pretty darn quick. On to what I've prepared. The first thing I look for is co-design. I'm looking for a diversity of relevant lived experience, not just one person who's supposed to represent all consumers, but a diversity of lived experience that shaped the research question. We're talking about co-design right from the start. Shape the research question and the study design. And the other thing is, if you're asked for a consumer-led proposal, it must include lived experience. Too often I see the CEO of a patient organisation listed as, for example, a co-researcher, and there's no evidence of how that individual has engaged with a broader audience to bring genuine lived experience into the study. Access and inclusion, this is tough. I'm not pretending that this is easy, but I'm looking to see what efforts you've made to reach people who are offline, to make your study accessible to people with a variety of disabilities. Are you including frail, homebound and bedridden people? Have you done anything about looking at culturally and linguistically diverse communities? What are you doing about people who are rural and remote? And also with clinical trials, I'm really looking to see if your cohort reflects the profile of end users. If the bulk of the people who will be affected by your research are over 70 and your study cuts off at 60, which is very common, then I'm going to be going, okay, what are your plans for a follow-up study for people with the age group who are going to be using your therapy or your intervention? Same for gender or common comorbid conditions. I look at a grant for a cardiac intervention, and if you've excluded, going or planning to exclude everybody with diabetes, then I'm going to question the scope of relevance of your study. So I'm not, again, I reiterate, that's not easy. And if you're going to do it, you need to ask in your grant application for the resources to do it. The overarching theme for me is, will the world be different for consumers after the study? Now, that does not mean, before people get anxious, that I'm only interested in phase 3 clinical trials, because you might have done a systematic review of some pathophysiology, or you may have been consulting with consumers, and you've come up with a brand new, bright, innovative idea that maybe has a 90% chance of coming to nothing, but 10% chance of changing the world, I'm interested. So it's, when I say that, it's quite broad, but I am looking at it. Will consumers care? Will it make a difference? Because if it doesn't, then as a consumer representative, I'm not that interested. There's a photograph on my slide just to clarify some of these things. So some of you will know the researcher in the photograph. It's Mike Musker, who's currently at SAMRI and the University of South Australia. And Mike and Martin Lewis asked in a grant application for money for home visits so that they could include people who are so unwell that they are housebound in the cohort for this study. So prior to the occasion where the photograph was taken, there were emails and online questionnaires. And Mike and Martin came to the front door and collected samples, raced them back to the lab at SAMRI, and then followed up the home visit with a telephone guided interview. So get a bit inventive. Just really think about the consumers to whom your study is important and what you're going to do to involve them. Thank you very much.
Thank you so much, Penelope. That was such an excellent point, and I think really eye-opening for lots of researchers to really include, everyone in the study when they say they're going to be doing consumer engagement in their study, to really think about, okay, who are the consumers actually, and who will be affected by my research. So, and to really include that. So thank you so much. Then my next question is for Olivia White. My question for you is, what are some common elements you found across successful MRFF applications?
Well, I guess I'm going to echo Susan and Penelope's initial statements in that the successful applicants have really understood what the call's about, and they've connected to all the selection criteria and really been able to show impact of their research. So I guess I should also clarify that the groups and the panels I've been involved in have all been about translation of research or commercialisation of that research. And they're really open and upfront about what they're looking for. Sometimes it's a very specific call in a very specific disease states. And, as Penelope mentioned, it has to have consumer involvement and engagement and consideration. The other thing to consider is that a lot of these groups and calls might be either put out by the MRFF directly or by an intermediary like MTP Connect. We've got Dana Bell on here today, who are specialists in an area. And therefore you actually have a group to go to find further information on what this call is about. Specifically, one of the ones that I've been involved in, which is to do with cardiovascular disease and diabetes, there are information sessions run before any research project call, and they are a great avenue of information and resource for you to listen to, whether you do it live or look back at when you're writing your grant, because they have lots of little gems of information about really what is going to be competitive. And I think that's what you need to consider is, are you going to be competitive in this call? And those that have been able to harness that have been successful. A little connection to what Susan was saying in terms of how things are rated and what gets through, you often can find out what sections of the grant has a certain weighting. So sometimes, the science behind things will be weighted more highly than the translation. Other times it's equal. And so that's a really important thing to look at, because there's some easy wins there for you to get points, I guess. The most successful applications that we've seen and I've seen are those that really hook you from the start. There is a strong sense, I guess, of science communication in the language. It's clear to understand what purpose you're trying to achieve and the impact that your solution will have. And that is threaded through the whole application. Importantly, the people you have in your team is vital. And, as was mentioned earlier, they do need to have some expertise in that area and diversity of that team, and not just in what's on people's CV, but in terms of gender, in terms of ethnicity, and in terms of career stage as well. So the successful applications have been able to tick all of those boxes, and once again, always come back to connecting to what is the purpose of the call.
Thanks, Olivia. That was a really good answer. I really liked what you said, hook from the start, and it's about the science communication of it all. So it's really grab them from the beginning and really understand what the call is about. Moving on to Niranjan, our last set question before we open up to the audience Q&A. Niranjan, when you review different grant applications, what makes one specifically stand out from the rest?
Yeah, thanks, Augustina. I guess I would start with saying they would have all the points and my colleagues just mentioned. So I mean, just thinking beyond that, I did some caveats. My experience has been mainly in sort of technical, digital health kind of oriented grant panels. So it's going to be skewed towards those kind of panels I've been on. So the further points I would add to that is almost all the ones that are competitive will have a good problem and will have a good approach and good solution sets. So the question is, what makes one stand out from the rest? And I think there's two things that I would say, reflecting on my experience, that stood out. They will not just have the problem, but they'll make a good case that it is worth solving the problem, and that just means many things. So it's the problem is contextualized better to the current time and understandable and relatable to the in the setting where the problem is being tackled. It's and around that, there is one. Some of them could articulate the problem really well, but this is a common mistake you see that. But the problem is very much a local problem. But it has been solved elsewhere, and those kind of projects probably won't get rated well. So it's the problem has to be something new. It's not solved by anyone, but solved locally as opposed to a local problem that doesn't scale beyond. So that's sort of one common thing I see in I've seen. I would also say there is the sense that part of making a case why it's worth solving is that it's more immediate and it's not too far down. In other words, suppose they were successful in solving the problem, the path to translation is not too further apart. We can clearly see how this would sort of it can go beyond research. So that potentially adds to that, making the case why it's worth solving. And the second thing is more their approach itself. So it's sort of making convincing argument about that they have the right approach to it. And obviously that goes beyond technical capabilities, which all good grants tend to have. They will have the right technical skills, but there are these soft things beyond technical things that sort of make a case why you have a good approach. That maybe echoing what others said about consumer engagement, stakeholder engagement, it's sort of a deeper engagement rather than a superficial one based on names or so a good engagement. When you read it, you can sort of see there was different types of interactions on different phases, and the intricacies are nicely intertwined between different stakeholders. That's obvious, and it's not something you can just sell by writing nicely. That helps to understand, but it needs to be reflected in reality as well. The other thing I would say that makes the approach good is that in MRFF projects, not least the ones I've seen that do well, they're embedded in the in implementation setting deeply. They're not like sort of standalone projects. You recruit people or you do them somewhere in a simulated or like a controlled setting. They are actually happening in the setting where they're meant to be used. So those kind of projects, and that sort of ties back to how your approach is developed. If it's embedded in the setting, then there is a better engagement with consumers and stakeholders. So there's that interconnection. I think those are like the main things I would say that sort of made something stand out. So ultimately, it comes to the one question I would say is when you read the project, if you ask the question, so what if you're successful with this project? Why should I care about it? And if there's a compelling answer to that, then that's a standout application. I think that's probably all I have to add, because all the other points were covered nicely by our colleagues earlier.
No, thank you so much for that answer. I think that was a really good answer, and it kind of completes all the previous points. I know, we got a really comprehensive, I guess, picture of what it is that the reviewers are looking for. And you really specify that, we need to make a good case that it's a problem we're solving, and it's not a problem that's been solved elsewhere. It's not just a local problem that hasn't been solved here, but it has been solved somewhere else. Like, we need to, researchers need to be able to look at something look at an approach to solving a problem that's new and not been done before, and really contextualize that problem and really be compelling in the so what of the project. I'd like to thank all of you for these. Now I'd like to actually ask the audience online, the participants who are on the webinar, to ask these reviewers a question. And it can be to all of them, it can be to a specific one, but you can use the chat box, or I guess raise your hand. So I can stop sharing so we can see everyone. Or so I can see everyone, so I can see the little hands if you do put your hands up.
While we're waiting for a question, I just thought of something, that there is actually a great webinar on MTP Connect's website called Show Me the Money. And it is dedicated to how to write a good grant, how to get the best out of it. So that's something, and I can look it up and pop it in the chat as well for people to go and have a look at. Is often worth sort of getting, training for these grants. I know that sounds a bit strange, but sometimes the calls come, they only have a short window, and so you have to sort of get organised very quickly. So if you can get prepared and start thinking about how you might want to position your research for a MRFF call, this webinar might be able to help you. So I'll go look for that now.
Thank you so much, Olivia. We'd love to get that link, and I can also share it as part of the Spotlight series as well, given that we've spoken to MTP Connect in webinar 1, so it can be a really good complementary resource to have. I see there's one question from the audience, so I'll just go ahead and ask it to our panelists. Do panels always consist of reviewers with the area content of expertise, or are they diverse? I think this is a general one to all 4, if any of you would like to answer that one.
Yeah, I can. Oh, sorry.
I was just going to say, the first time I was amazed at the diversity. The panel had been so carefully constructed that there were experts in every different aspect, some of which were topic experts and some of which, so for a consumer, if I'm on a panel as an expert consumer, there'll be another consumer on the panel who is there as a generalist consumer. There'll be people who know nothing about your topic area, but know exactly how to assess the costings and go, you've undercosted or overcosted this grant. It doesn't matter what it is, there will be an expert there.
Mhm.
Yeah, and I can assure people that they're really diverse as well. They're diverse, probably not including the ECR, MCR so much. They often are MCRs. I think that's actually reasonable because the panels that I've sat on have been very sensitive to the diversity in the actual investigator team. That's often a criterion. So there might not be, ECRs on the panel, but that the element of that is included. And there are always, my experience, people with appropriate methodologies who understand that. They are, the innovation that's happened with MRFF is that they will call in international people for the panel. And that is something we've been asking in HMRC to do for a long time. So that's why I think these panels are much fairer, because the international folk are content experts as well, and they know the international literature. So you cannot, grants cannot get away with saying this is really novel, because someone from the States will go, we've been doing that for years, or, wherever it is in the world. So the panels are really strong methodologically and content-wise, and also discipline background. So there'll be people who are researchers, people who are clinicians, people like myself who are clinician researchers. So that diversity is covered as well. And I've never sat on panels where the consumer voice is heard as much and as regularly and given as much weighting. So I think, the panels are strong. The chairs are really strong. I've sat on panels where the chair everybody has had to speak or be given the opportunity to speak on every grant, which is, I've never had that before. I had that in a panel a couple of months ago. So there was no domination by one particular discipline or gender or anything like that. The chairs have been really, really well coached in ensuring that every voice is heard. And if somebody's not speaking, they'll get called up. They'll say, no, we haven't heard from you for a while, Susan. We want to hear your voice, say as an allied health person, so that it's not just the medical perspective or the nursing perspective or any one perspective like that. They're very well chaired, in my experience.
Wow, that's great to hear. That's really good. We have another question from the audience. We have Claire asking, often the funds available for MRFF calls are quite limited, but the vision for the project is broad and would cost more than the money available. Is it possible to ask for one component from the one MRFF call and other components in one or more other calls, so long as the components address the aims of each scheme?
I can answer that a little bit broadly, I guess. I think, Claire, it would depend on if there's overlapping project components and activities. One thing that the scheme doesn't like to do is to fund the same thing that something else has done. So if it's a different activity, a slightly different activity, but connecting into an overall outcome, that can normally be okay. But you do have to disclose if you've received MRFF funding from another scheme before and what activities that has been for, because they don't like the double dipping. So as long as it can be seen as complementary and not the same activity, I think you should be okay if you can articulate it and just be honest about it. Get in touch with the organisers of the fund or whoever's holding that fund to discuss it, because that often is your best case as well.
Thanks, Olivia. Any other panelists would like to add?
Strong limits on how many, if there is some overlap, there are really killer limits on how many grants you can put in or that your team members can be on. And that's probably something that all of the institutions have really suffered from, not, where you're only allowed to put in one grant in a particular scheme. And that means all CIs. So just be really careful about that.
Mm-hmm. Thanks. Let's see if there's other questions from the audience. Regarding the expert panel medical, what is the proportion of physicians to surgeons on these panels?
That depends on what the call's about, really. So it really comes down to if this is a diabetes call and it's looking at prevention, you would have the relevant clinical experts around that. If it is to do with a surgical intervention, then of course you'll have physicians and surgeons on there, but it really depends on the call. But I think you can be assured that you do get the balance of expertise from a clinical sense. I think all the MRFF panels I've been on have definitely had that component.
Thanks,
Yeah.
Olivia.
Probably a bit too specific in terms of discipline bases. And I don't think I've not ever heard a bias. I mean, I understand within medicine that there is an issue between physicians and surgeons. It doesn't come up because the calls are about the diagnostic population. And they tend to be quite agnostic about the actual intervention.
Thank you. Niranjan, would you like to add a comment to any of these questions? Or?
Yeah, I guess I mean, I've been on the non-disease specific type of panels, so there is representation of physicians and GPs and so on, but not. It's well balanced and it's not skewed towards one profession or others. And there's in the panels I've been on, there's also expertise from business development to commercialization and very divergent views are represented in the panel. And I think that's echoed by others as well.
Thanks, Niranjan. I'm just going to go to another question from the audience. We have Rebecca saying, great insights, thank you. Investigator teams are often encouraged to include clinicians and EMCRs who may not have strong research track records. Can you give advice around how to justify the inclusion in these instances?
I'm happy to have a crack. I've seen grants go down because they don't have clinicians and ECRs on them, because they don't have a diverse, a diverse team. So in the capability statement, there's the opportunity to talk about the different roles. And the panels are looking for the diversity across ECR, MCR, and having the right clinicians as well as experienced researchers, and Penelope can talk more about the right kind of consumer voice, not just the token tick box stuff. So it's not hard to justify them. You just need to say, we have a diverse, we've got an early career researcher who is at this stage of, and he or she brings this, they will be mentored by this person or that person and so forth. And it's not an issue, and it's certainly not an issue, the clinicians as well, that to have that voice and to have the consumer voice. So that's again why I think these panels are really exciting, because there is a recognition of having that diversity in the team. So you're more likely to go down for not having it than having it. Yeah.
And one thing to add, because Susan mentioned consumers, as a consumer, I've been a lead investigator, co-investigator with equal footing with the chief investigator for the application. I've been a partner. I've had lots of different designations. I've been one of a team of consumers who are identified as an involved team. So how you frame, as Susan said, who these people are, what their background is and what their role is, and where they fit into what you're doing, I think that's where the strengths and weaknesses can come in your application.
Thanks, Penelope. That's and Susan as well. I think that's really valuable. So it's really not about their like expertise, it's the diversity of who's on your project and having the correct people for the correct people for the correct project. So it doesn't matter whether there's like a massive track record or not. If it's the correct person for that role, then that's what you want to see as a panel. There's another question from the audience. So how important are the letters from partners in gaining more points from panels?
It's not, I guess I wouldn't put it about gaining points, but it supports what you're trying to achieve and it supports their inclusion. So if you can do that, that's great. It sort of shows the legitimacy of the partnerships and actually what's written in those letters, that we do read them. So it's not just the letterhead and who it's signed by. So the contents of the letter is important as well.
Okay, that's very true. Anyone else would like to add?
I guess I'll just add to that. It's not just the letter that's important. It's also the role of the partner in the approach and the project. And then there has to be a synergy between. I have seen projects where there's a strong letter, but and it sort of reflects maybe some relation the team has with the partners, but it's not really reflected in the role they will play in the project. And those kind of projects have been rated down or put down by other panel members. So
Thank you.
The harmonization is important.
That's very, very relevant. I have a fun question here. What have you experienced left field in an application that has had a wow factor? Yeah.
Someone once wrote in their opening statement that if we don't do anything about diabetes, juvenile diabetes, then all of them will be crystallizing their arteries by the age of in their 30s. And I think, an opening line that has high impact can really set the scene for the application. So it puts you in a frame of mind. The other is utilising, if you've got the ability to have supporting information or documents or a PDF that is a supporting document, not to just fill that with the technical or your background research, to try and utilise that a little bit as a pitch, which can be a different frame of mind and how you present. But utilising maybe even your tech transfer officers or your commercialisation partners in the organisations you're in to put that supporting information together so that it's really trying to portray what you're trying to achieve and the impact that this money will have.
Thank you. Anyone else?
I can add some on that. Obviously the projects that I have seen that have wow factor are high in innovation. They tend to be sort of right at the cutting edge, and when you sort of look at that lens, the cutting edge lens, the risk is high for things to fall apart, and the ability to sort of account for that or take into account all those uncertainties that come with higher risk and preempt that in the proposal. That's probably the key that I've seen in some projects, that with high risk stakes, they're also able to preempt all the things that go wrong and have some mitigation strategies built in to convince they have thought through all the things.
That's really good. Thanks, Niranjan. So yeah, the more cutting edge you are, the higher risk there is for things to fall apart, and the more you have to really take that into account and show how you would address that. Yeah. Susan, would you like to add something?
Yeah, I think there's certainly the panels that I've sat on are averse to innovation. And, there has been a bit of a feel that, other granting schemes have become a bit safe. There is an appetite for innovation here. However, the MRFF have brought in a really strong risk mitigation. You have to do a risk profile, and at the end, you have to rate, the grants on low, medium, or high, or something around risk. And if something's risky, like you haven't addressed it or you've glossed over risk, you get low. You could have a really high score and you'll get knocked out. You won't be considered on those two final parameters. I forget what the second one is. There's two. So you have to be honest about risk and be really upfront about that you've considered all of the risks and put it down and not tried to fudge or hide stuff. I think, you know, wow factors, as Niranjan said, innovation is always a bit of a wow. And there's also a, look, this has to be done. You know, if you've got a really compelling story, that this has to be done. You know, we've got to do this. It's really important.
I think,
you know, there are, but really establishing a gap based on good evidence. So this sort of cherry picking literature review to kind of justify your little pet theory, it doesn't wash. People are really looking for clear evidence of a gap, a practice gap or a knowledge gap. And it's a quiet wow factor, but it gets people going, okay, yeah, we need to do this. The lived experience voice saying this is a gap for us, backed up by published evidence, and then pilot data. Not wow, it's just really solid, holding the reader by the hand, taking them through this story about why this absolutely has to be done. It's so compelling.
Thanks, Susan. Olivia, I see your hand is raised.
Yeah, I just wanted to build on the risk side of things. So innovation is risk, and don't be afraid of risk. In some of the grant applications that I look at, you often need to put a risk register in, and a green risk register is not a good thing. It's okay to have risks. High risk, high reward. It's about what are your strategies to mitigate for that? What happens if it goes wrong? It's absolutely okay, but being upfront, as we've just said, is really important, because if you don't mention it, and at the moment, if you don't mention COVID in a risk register, you're going to be knocked out. It's just how it is. It's the reality of the world we're in now, and you need to have that as part of your project plan. You need to have some contingencies about what that means. So yeah, enjoy the risk, take it on board.
Yeah, risk is scary sometimes, but it's worth taking on board. Any other questions from the audience? I think there's one more in the chat box. This one specifically addressed to Susan. So it says, Susan, regarding risk and control, do you believe that sometimes having resources and money to assist to mitigate this can also restrict an application?
Yeah, I was just starting to write a response. I think it depends on the story that you can put into that. And I think Penelope gave that really good example where, you know, of taking a trial into the home as a way of mitigating risk and increasing recruitment, for example, is a classic example of understanding the methodology and understanding how you can minimise risk. So that kind of distance or, you know, recruiting for a trial outside of a trial centre, for example, is a great way. And then you can ask for the extra money to do those home visits because it makes sense and it's inclusive and it makes sense from a methodology point of view. So I think there's a qualified yes. You can ask for more money to manage the trickier situations, provided it's really well justified and it's got a principle behind it. It's not just being fancy or clever or, you know, whatever, but there's actually a strong inclusivity principle or a scientific principle that backs it up. I think, you know, you've got scientists and clinicians and consumers who are really interested in best practice. So yeah, don't not ask for that stuff.
Thank you. Penelope, would you like to add to that?
No, I wanted to, there's a question in the chat box that you've gone past.
Yes.
Which my experience is that this is always a really big discussion when people are preparing an application, which Amanda's asked, how important is the order of CIs on the application? For example, is it a disadvantage to have an ECR as CIA? So I'm interested in what the other panelists have to say about that, because I've just heard discussions go round and round and round and round on this topic.
Yeah. Thanks, Penelope. And yes, correct. I had missed that question in the chat. So thank you for Penelope for bringing it up, and Professor Clark. So is it So is it a disadvantage to have an ECR as a chief investigator? And how important is the order? Can any other of the reviewers add to this, or?
Look, it's not a disadvantage, it's not an advantage. It depends on, you've got to convince, like this is big money and it's public money. And if the ECR has no experience in leading a big grant, then we shouldn't be giving an ECR a big grant. You know, they need to have experience running small grants first. Hopefully that's going to sound a bit controversial, but this is what somebody said this to me when I was an early career researcher, is you need to demonstrate that you can manage projects at a smaller scale before you go for a big project. So I'm just going to be a bit outspoken about that. But however, on the other hand, if you've got an ECR who has demonstrated that they have run projects well as the lead and they've got strong mentoring, then absolutely, we have absolutely given good points to an ECR being the lead investigator when all the evidence is there that they are ready for this now. You know, that they have got this, they've got the experience to do this and they've got the support, and that this is going to be a great opportunity for them. So it's not a tick box, oh yeah, we're going to give a lot of money to ECRs. It's about demonstrating that they've got that. Now, of course, there's ECR schemes that completely negate everything that I've just said now. So, you know, this is a controversial field, but I think don't be frightened about putting an ECR in as lead if you've got the evidence. But do pitch it relative to the size of the grant. So if it's a $3 million grant and the person's only ever had a $30,000 grant before, that's too big a risk.
Yeah.
But you know, if it had a, you know, if it's not a big lead, it's not a big lead, it's a $300,000 grant and they've run a couple of grants, then yeah.
Thanks, Susan. That makes a lot of sense. And thanks for Penelope for bringing that question up. Niranjan, would you like to add something? I saw you unmuted yourself.
I accidentally unmuted. I guess I can just only add from my limited experience of 3 or so panels. That was never a factor that came up in as an issue that was discussed about where there were applications led by people at different stages of career, and it was not an issue that was discussed. Although there were scenarios where they were led by very experienced researchers, and by experience, it also means they have lots of grants from the past, and there have been cases where the other panel members would raise that the person already has these 4 or 5 other grants, and they'll cross-check and say, are they capable of seeing this through? And that would sort of set tone for this negative strand of conversation. So I would sort of put an alternative view on that, maybe probably not it's just my opinion that I would say ECR should be leading grants if they are the right fit, and if the case is made clearly, shouldn't be holding them back. That's my view.
Thank you. Thanks so much. So we've got 4 minutes left to the webinar. Is there anyone else who would like to ask our panelists a question from the audience? Your last chance. Okay, so I think that kind of goes around all the different topics we looked at. Yeah, so what is your, we have one last question from the audience just in time. So what's your biggest takeaway from your experience as a reviewer for MRFF grants? Just quickly.
I'll go first.
Yes.
My biggest takeaway is that that there's such amazing work that's going on in Australia, that it is competitive. So that, you know, to try and put your best foot forward, it's quite amazing to see what is happening and the collaborations that are happening, but it is competitive. So if you can find that edge and communicate that well in your grant, then that will give you a further edge.
Thanks. Penelope, would you like to add something? What's your biggest takeaway from your experience as a reviewer?
I think that for me, the biggest thing is be honest, be accurate, explain what you're doing, because the reviewers can only work with what you give them. And if you haven't said that you've done something, we don't know that you've done it. If you haven't explained why you're doing something, we don't know why. So people, you know, between us, we've covered a lot of ground, but always it's got to be in your application, and we have to be able to find it quickly and easily.
Thanks, Penelope. That's really good. Niranjan, would you like to add something? What's been your biggest takeaway?
Yes, that's a hard one to summarize. I think I would say that it's very important to be solving the right problem, not the problem that we have somehow thought that we have spent last 3, 4 years, 5 years developing, and just micro aligning it to the scheme. That can actually derail the whole grant completely. So taking that beginner's mindset and really understanding the problem and working backwards, that's given the nature of these panels, which are divergent, multidisciplinary, multi-professionals, like you almost have to approach these more from like as if you're starting a business and who is your customer and what's the sticky point, why will they pay for it, and that lens probably is my biggest takeaway to bringing that thinking to research.
Thanks, Niranjan. And Susan, your last?
Yeah, I think my takeaway is similar. We're kind of used to very investigator-led, where you ask for money for your pet idea, and this is not entirely. These are often more targeted calls where a problem has been identified, a gap has been identified, and we as researchers are given the opportunity to come up with solutions or ideas for that gap. So you have to write to that. It's not about you and your idea as such. It's about how you address the gap that's been identified. So getting away from that real investigator-led autonomy. So you are being invited to help people address the gap, I think is not all schemes, but a lot of schemes. That would be my
Thank
takeaway.
you so much. Thank you so much. And thanks to all our panelists. I'm just going to share my screen one last time. Thanks to everyone who's attended, and thanks to our 4 panelists who've generously given their time to us today. We've learned a lot on, how reviewers think and what they look for and what stands out in applications. And next week, we'll be talking to research support offices. So within your own organizations, who can you go to help you apply for these grants? What can they do to help you? What supports are available? So I'd like to conclude the webinar right now and thank everyone. And I hope to see you all again next week for our last webinar on the MRFF. So the last of our webinar spotlight series for the month of June. So thank you so much. And we'll see you next week. Thanks.